Ever wish you could fix your shoulder pain in seconds?
Yes.
Oh.
Well, I tell you what, you're in luck today because we are going to go take a trip down memory lane to give you a comprehensive list of options to fix your shoulder, and some of the best therapists in the world are going to be reviewed.
And make sure to stay tuned because after that we have a bonus tip we want you to try, and no exercise is required for that.
That's right. I was just going to say the memory lane video has got, I think, it's got millions of views, a lot of positive comments.
Yeah, I think it's you guys, but maybe not. Anyway, should we time travel? You ready for your
There
sound
you
effect?
go. Woo, 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 woo.
Bob and Brad, the two most famous physical therapists on the internet.
All right, so these are 5 exercises, and how you can do this in seconds is I just want you to do one of these exercises every few hours, and it only takes you seconds to do it.
Right.
So I'm not telling you to, everybody's busy. Nobody has time for pain. It's interesting. I just had one of our aides, she hurt her knee.
Yeah.
And she goes, I don't have time for this. That's right. You don't have time for shoulder pain.
Right.
So you don't have time to rehab it either. So I'm going to show you things you can do throughout the day, maybe even in the office or wherever you work.
Right.
So
you're going to try all of these and only do the ones that's successful, because more than likely not all 5 will work on one person. It's usually 1 or 2 are going to be successful. So work with them.
Exactly. Find the ones that are working for you and stick with it. And the thing that we're trying to treat here mainly is what we call impingement, because impingement often leads to rotator cuff problems. And I'd say about 80% of the shoulders that we see are having this difficulty.
Right. As a matter of fact, our hanging book has studies saying this is the primary source of shoulder pain. Not all of it, but a majority.
So very quickly, we're going to show you what impingement is. So it often occurs from kind of poor posture, leaning forward like this, or being hunched forward. And what that causes is you have the humeral head here, and it goes into the socket here, or the glenoid fossa, and you have a tendon going over here. That's what this red thing is. And if there's not enough room in there, what's going to happen when you lift the arm, it pinches. I don't know if you can catch that at all.
I'm going to show the healthy way is this. You have a gap in there. The joint drops down where it's supposed to. The rotator cuff is doing what it's supposed to. Unhealthy shoulder, pinch. And that's about where you get it, is where your shoulder's around 90 degrees. It starts to pinch. Ouch, ouch, ouch.
And what happens over time, you start to saw away at that tendon, and you can actually get a rotator cuff tear. You can tear on the muscle. I mean, it throws everything off. So these exercises are designed to get you a little more room in there.
Right, so we eliminate that impingement or that squeezing, pinching, nasty, owie, painful stuff.
All right, the first one is the one that I've been doing. I actually, without going into too much detail, I have a little bit of winging on this scapula because I actually lost a muscle when I was younger. I had a nerve damage.
Maybe you could go find it.
Yeah, maybe I could find it. But so this one tends to come forward more than the other ones.
Right.
So I have to, every so often, I mean, this is something you do throughout the day. You want to do shoulder squeezes. And they're very easy to do. You can do them no matter where you are. You can do them standing. You can do them sitting.
Sure.
And I'm just going to go ahead and bend my elbows, and I'm going to squeeze my shoulder blades together.
You can see the wrinkling of his clothes, showing that movement of the shoulder blades. And from this side.
Are you saying I just got my clothes out of the hamper?
Yeah, they're wrinkled. You got to get them taken in, Bob. Once again, to the press.
Yeah, pressure on. Well, not pressure on. I'm sorry. 1, 2, 3, 4, 5. I usually do.
Is that what you
1,
counted
2, 3,
like that
4,
in your
5,
head?
yeah.
Everyone's got their own little ways. I just go hold, and then it's that's my mantra. Hold.
By
relax.
strengthening, you might come over here, Matt.
I don't know.
I called you Matt, Brad.
Wow.
Matt's my son. By strengthening these muscles, you're strengthening the core of the shoulder.
Right.
And that helps, if these are held back right here, that puts the shoulder in the right position.
Right.
So instead of being like this, they're back like this, and that's where you want them to be.
Right. They work much more efficiently and less pain.
The next technique, so that's one, I definitely want all of you doing that one.
Right.
That's one I want you to slip in throughout the day. The next one is our mulligan technique, which we're a big fan of. And you can just do this off the back of a chair. And again, this helps set that humeral head down in the socket to give you more room for the tendon to glide through.
Right. Maybe you should do it with the other arm so they can
Sure.
see.
So I'm right here. I'm pushing down into the chair, and while I push down into the chair, I walk away. And this is my bad shoulder, so this is the one I should be doing it on.
Sure.
And I can feel this actually stretch really well.
So you're kind of pushing not straight down this way, but down and kind of towards your toes. So it's kind of going that way.
You hear that crack?
Oh, I didn't hear it, but I believe, it's
Yeah.
always louder to the person that has, but you can see his
crack
range
again.
of motion. Yeah, I did hear that.
Yeah.
Audible crepitus. That's what we call it in the field.
So we're trying again, it's a sneaky way of getting more motion,
Right.
and it's a sneaky way of getting more gap.
Right. With this technique, if you're unable to do this, but you do this without pain, it's the right thing. But if I've had some patients do this,
And they didn't like it.
Right. It's painful. It creates some sharp pain. If that's the case, that one goes off the list. We go to the next one.
Did you want to show it with the Booyah?
Oh, sure. No, actually, why don't you want to chew, Bob?
Okay, so if you did have one of our Booyah sticks, you could use the Booyah stick, and you can actually you can do it one of two ways. You can walk away from it like this, or you can also push down and move it away like this. So either way, but it works out really well to walk away and push down the entire time.
Sure. You know, and it's something, if you don't have a Booyah stick and you don't want to buy one, you can. We've had people comment they're using the broom handle or something.
Yeah, absolutely.
You got to do it on carpet or something so it sticks. That's what we have, these nice rubber ends.
Or the back
for.
of a chair like we
Sure,
just did.
yep.
So next one is shoulder extension. So now we're going to start working on bringing the shoulder back like this, stretching this area out here, again, making more room for the shoulder to do its job, to work correctly.
And we talked about people who started these. Mulligan, he's a famous physical therapist. I think he's getting up there in age. I think he's still alive. He's got a whole system. This is McKenzie technique.
McKenzie technique too.
Yeah, and he's developed his own system that's worldwide popular in the therapy world.
So we're working on increasing the amount that the arm goes back. Brad, I thought you showed really well on the countertop there.
Yeah.
If you want to, well, we got a messy countertop. Don't we?
Look at that. We got an arm here. We got my glasses. We got a screwdriver. We've been busy today,
we've
Bob.
been busy.
So, in the early phase when your shoulder's tight, you may just go up to the counter here and then get your good posture, and then you just squat gently. And right now, as I do that, that extends my shoulder. And you just go until you feel some pain, not much, then you come off it. A little pain, off. So we go to pressure on, but not into the pain. You never go into sharp pain. When the range of motion starts to get better, and it's like, oh, this is getting much better, much less pain. Along with that, you're going to find that going in front is easier. But to increase it more, you open up the cupboard. Some people say we got a crooked cupboard door on there.
Yeah, we tried to fix that too.
Yeah. So here we go. And now this would be this is for high level. This is for someone whose shoulder's really doing well. They just want to get it to, maybe they're a baseball thrower or, pitcher thrower.
Yeah.
Yeah, I'm in it today, Bob.
Tosser.
Tosser, yeah. One way or another, there you go. So you can use other things in the house for
things
stretching.
that just, end up being the right level for you. Go ahead and use it.
Sure.
So, all right, next one. Again, you don't need to do all these. I'd have all of you doing the shoulder squeezes. With the other ones, I would kind of find out which one seems to be working the best for you, decreasing your pain. This one's a really easy one. You just use a belt, and you're going to go ahead and, let's see, how do we do this again?
This is a little challenging to get it set up. But
yeah, there we go.
And the reason, use a belt that is smooth and shiny and you're going to do it with clothing, and you'll find out why in just a second here. Sometimes if you have a little help.
There we go.
That's where you want to get to.
That's what I was trying to do.
Yeah. So this arm is relaxed. So we're
What I'm going to show you is quite often what you're going to find is the tight arm is down here, where the other arm I can put way up here.
Right.
And so I want to get this arm up to that, equal with that one. So you're just going to go pressure on, pressure off. This belt really does work well.
I know.
Once you get it set up.
Yeah.
Takes a little bit of doing, but it slides really well.
Matter of fact, we did a video a number of years ago on a patient that she was set up for shoulder surgery. And then she said, can I do therapy? And the surgeon said, well, go ahead, you can do it. Within 4 visits, she was doing this exercise. No surgery needed.
Wow.
Her arm was going from here to here, to cancel surgery. And I still see her, and it's still in good shape.
Wow,
So,
nice.
yeah.
Yeah, there's some miracles every minute in the Bob and Brad Clinic, right?
There you go.
All right, The last one we're going to do is this one. You're going to need some equipment. I mean, you need a place to hang.
Okay.
And Brad and I have become big fans of this. I don't know. Do we have our book around? You go ahead and start hanging.
I think it's right up there by the prescription sunglasses or whatever. But are you over here, Liz? Don't worry about Bob. He's just looking through our library, quote unquote. But yeah, you just need a hanging bar.
Yeah.
And you're just simply going to relax and hang. And when I first heard this, I thought this is crazy. It's going to make the impingement worse. But once I read the book, understand the mechanics, and I start trying it, and we start working with people doing it, it's like, yeah, this can be really effective.
Yeah, we've become big fans. It's such an easy thing to do if you have the equipment, and you can wear gloves to help make it easier. So the book is Shoulder Pain: The Solution and Prevention. It's by John M. Kirsch, M.D. We have it in our favorite books, don't we?
Yeah, we do. Yeah, he's an orthopedic surgeon. Matter of fact, he does his practice 30 miles from where I grew up in Wisconsin.
Does he really?
Yeah, Stevens Point.
Oh, cool.
Yeah.
Yeah, my daughter went to Stevens Point.
There you go. This is a nice town.
Yeah, it is.
Got a river running through it and everything.
Go to Stevens Point, too.
There you go. So here you're going to hang 10 to 30 seconds, depending on what you tolerate, up to 3 repetitions of that. And depending on how you respond to it, so the first time you do it might get sore, but after you do it for a few days, you'll be able to do this 2 to 3 times per day and we've really had good success.
And you still said seconds. Remember, we promised seconds. And yeah, so it's 30 seconds.
There you go.
Out of your day, and you can make a great improvement.
Oh, that's right. We've got to stick with our titles.
All right, thanks.
All right, we are back. You just looked at some of the best therapists historically with Mulligan and McKenzie, but now we've got a new therapist that's got excellent information. His name is
Rick Olderman. You can find his stuff at rickolderman.com. And oftentimes when he addresses shoulder pain, he looks at the shoulder blade itself or your scapula. And he has found that most people with shoulder problems have a depressed shoulder blade. And I am sitting like this to show an example of what that may look like. If my arm is just resting at my side or down here on a low surface, you could see how much more downward angle or tension I have on my shoulder muscles up here, my upper traps, in the rotator cuff, everything. It doesn't function as well. So in order to eliminate some of the pain, simply raise up an armrest if you happen to have a computer chair adjustable armrest.
Sure.
If you are seated on a normal chair, couch will show what you can do as an example. So you can see how much strain I may be having on some of these muscles before, and now I am very relaxed, taking any pressure off of the shoulder area.
You just had a person in the clinic you did with this, right?
I tested them out. There was more of a neck pain issue, but it all kind of connects.
Right. Basically the same concept. Now,
Yes.
if you have a chair and you work with at your computer or sit and you're finding your arms are too low, you want to elevate them up, take that stress off. If you don't have a computer chair with adjustable armrests, take a pillow, fold it in half, kind of squish it in there. And there it makes a really nice, comfortable armrest, taking the weight of that arm, elevating that shoulder like Mike just talked about, and it works well. You can do one on both sides. If this really works well, you're going to say either do this or eventually get a chair that has adjustable armrests. Whatever works. It takes the pain away. You'll like it.
If you happen to be on a couch or recliner, typically bigger armrests, you don't need to fold it up. You may just have to lay it sideways like this. And if you're traveling in your car, oftentimes you have an area to put your elbow on the door as well as on the middle console. Maybe that could take some pressure off if you're having shoulder pain while driving.
There you go. All right.
Now, if you're still having some issues with this and you want to check out more of Rick's methods, the next video coming up here is a lot of his techniques that we learned.
There you go. Shoulder pain. This video will help thousands of people that didn't know they had
Shoulder pain problems.
I
I don't
didn't get
know.
that very
We're
good.
rambling.
Bob and Brad, the 2 most famous physical therapists on the internet.